Hi everybody. In this video, if I can get through it, we're going to discuss the respiratory system. Yeah, kind of funny. I'm fighting to breathe and coughing while we're discussing the respiratory system, huh? But yeah, I'm struggling a bit today, so if I sound less than enthusiastic, I think it's because I have a pretty good reason. So don't take it personal, okay? So with that, let's move right to the slides. I always double check this because I don't trust myself. All right, that looks to be right. Okay. The respiratory system. 4 primary functions: to exchange gases, that being oxygen and CO2, to produce vocal sounds, to contribute to our sense of smell, and to regulate our blood pH. Like I do with all the other ones, I'll just go through this at normal speed, but you can pause it as much as you need to, so everybody can get to fill in the blanks. There's a lung cake. That actually looks pretty good, doesn't it? So respiration is the process of gas exchange. There's external and internal respiration. External, the air enters the lungs. Gases exchange with the blood cells. So the air, sorry, you're going to hear that sound of me chomping on my cough drops. I apologize, but it really helps to keep me from coughing, so I'm going to keep doing it. So from air to the blood, internal respiration, the blood travels to the body parts and exchanges gases with those tissues. So there we're going from the blood to the tissues. So that's external and internal respiration. Why do we need oxygen? For cellular respiration. Our cells use oxygen and sugar to create the energy we need in the form of ATP. Right, in the mitochondria, ATP is then used to power cellular processes. So it's pretty important that we have the energy we need for all of our cellular processes, and we need the oxygen in the presence of the sugar to make that happen. So here's an overview of the respiratory system. The upper respiratory tract consists of the nose, the nasal cavity, the sinuses, and the pharynx. The pharynx is what most people would call your throat. And in the lower respiratory tract is the larynx, the trachea, the bronchial tubes, and the lungs. So notice, like if you get sick with something, and they call it an upper respiratory infection or something like that, versus lower. So if you look at these body parts and which one is which, that'll tell you which part of your body has been infected by whatever agent that was. So here we have all of those parts labeled in this image. At the end of these slides, you're going to get a handout where you're going to have to label, and I think it has a word bank on it actually, where you're going to have to label these parts on that handout. That becomes your homework. That'll be due whichever day you're getting this lecture will be due a week from that day. I was going to take this slide out. I forgot. So we'll just move on. The nose bones and cartilage support the nose and the two openings, the nostrils. We have hair inside of there to filter out large particles. The nasal cavity is the hollow space behind the nose, and the nasal septum divides the nose into the right and left halves. So why do we have a picture of Britney Spears? I have no idea. Actually, you're supposed to be looking at her nose. I think the left one is her old nose, and the right one is her new nose. So a lot of people may have a deviated septum where it's not right in the middle, and it's more to one side than the other, and it makes it harder breathing through that one side. Anyway, and for other reasons, I guess also just for cosmetic reasons, you can move some of these bones around. And apparently that's what she did with her nose. Speaking of that deviated septum, here's an image of that, bending to one side, like I said. So when they go in and do this kind of thing, they'll go in and break it and then reset it in the space where they want it. The nasal concha. The bones that divide the nasal cavity, and they support the mucous membranes in there and increase the surface area. And there is a superior, middle, and inferior nasal concha. The mucous membranes warm and moisten the air as it comes in through there, and they also trap dust particles and pollen and things like that. And those particles will go right down into our stomach. So there's the superior, there's the middle, and there's the inferior, those three bones inside of our nasal cavity. And there they are, again, color-coded for you. The paranasal sinuses are the spaces within the bones, and they're named after the bones that they're in. We have the maxillary, frontal, ethmoid, and sphenoid. They reduce the weight of the skull, and they're also resonant chambers for our voice. The pharynx, like what I said, is the area that most of us would call our throat, is behind the oral cavity, between the nasal cavity and the larynx. So, like I said, this is a space and not a structure. There's the nasal pharynx, which is the superior region, the oral pharynx in the middle, and then the inferior region would be called the laryngeal pharynx. So they actually, even though our throat is not that big, they still divide it up into these three regions. The larynx, the enlargement at the top of the trachea, and it houses the vocal cords. It's composed of both muscles and cartilage. It's composed of the thyroid cartilage, which most people call the Adam's apple, the cricoids, and the epiglottic cartilage. So we're going to talk about that a little bit more. The glottis, the part of the larynx consisting of the vocal cords and the opening between them. It affects the voice modulation through expansion are contraction. And somebody in my house just decided to print something. So if you hear that noise in the background, that's my printer going off. We have false vocal cords, which help close the airway during swallowing. Those don't produce sound. And we have our true vocal cords, which do produce sound. Contracting and relaxing the muscles will change the pitch. And an increased tension equals a higher pitch. And this, kind of cool. I got a little video I want you to watch here. Let's see here. Yeah.
8 o'clock now on a Friday morning. It's the 19th day of October 2007. Nice people outside enjoying balmy weather here on the Plaza in New York City. We're going to get outside and say hi to them in a second. Meanwhile, we're playing them some great music. They're enjoying a classic Aerosmith tune, and there's a reason we're playing it. I'm Matt Lauer along with Meredith Vieira. And coming up in this half hour, Steven Tyler, like you've never seen him before. This is a guy who's belted out thousands of songs like Dream On over and over again. But what do you think all the singing has done to his vocal cords? We're going to take an up-close look.
Whoa.
Just one example. Look at that. That's wild.
And there he is.
According to some estimates, apparently his vocal cords have banged together 1 billion times.
Jeez.
Over his career. It's all part of the Great Human Machine, a great National Geographic special. We're going to find out why Steven wanted to be a part of that in just a little while.
Sort of brave of him to do that.
Yeah,
Stick
well,
cameras and stuff down his throat.
He's chewing gum.
Exactly.
All right.
Also, we have an important... And now
Thank you.
here's Matt.
All right, Meredith, thanks very much. Now to the human body like you've probably never seen it before, with stunning high-definition footage, radical scientific advances, and powerful first-hand accounts. A new National Geographic special plunges deep into the marvels of the human body and explores striking feats of medical advancement, including real-time measurements of Aerosmith lead singer Steven Tyler's vocal cords after recovering from laser surgery. Steven is here this morning with his surgeon, Dr. Steven Zeitels. Guys, good morning to both of you. Good to see you.
Good morning to
How'd you get involved in this?
Well, I was on tour for about 6 months, and I had this schmutz in my lungs, and I couldn't figure out what it was. And I wound up in actually the infectious disease clinic in Mass General.
You lose your voice completely?
No, there was something in my lungs, I couldn't figure it out. I wound up going up and seeing this gentleman, Dr. Steven Zeitels, who said, "How do you sleep at night?" I said, "On my back." He goes, "Well, it's probably dripping down and going into your lungs, and you have something wrong here." I said, "This is my guy."
How common is the condition he was suffering from?
Well, I think it's not too uncommon to have those kinds of symptoms, especially if you're changing environments. But ultimately, what it led to is problems when he was on stage, which led to the vocal cord hemorrhage.
And so you didn't just say to him, okay, start sleeping on your stomach. You said there is a way we can repair this, and it was with a pretty much of new technology used.
Well, then I went back on tour.
Right.
And I went from California on a plane, long flight, to Florida. And the next day we had a show, and I blew it out. Flat tire, so to speak. I couldn't sing, I couldn't speak. I went to see him. He said you had some broken blood vessels.
All right, so how did you repair the blood vessels?
So what basically happens when someone does this, and it's a very common thing to occur with singers, you have to wait till the blood goes away, because we worked to develop a specialized laser that had initially been used for infant skin who have vascular malformations, and then we organized a group to analyze using our vocal cords, so it was perfect for the blood vessels that have been breaking.
So you use this new technology to fix this problem, and then you guys decide, you know, you can also learn a lot from what happens afterward. So they hook you up with all these diagnostic tools. What was that like?
In other words, they put me out, and he zapped me with a green laser,
right,
which only sees red, which is red broken blood vessels. When guys get punched and they get hematomas in their skin, if it happens enough times, you get scarring under there. If that happens in your larynx, you can't sing anymore. So
and clearly for your profession, that's a bad thing.
So he's zapping it with this red laser, and you can literally see it on the show.
Afterward, as you start to look at his vocal cords in action upon healing,
Sure.
First of all, what was it like to have that scope so we could actually see that? Was that bizarre?
Very. They numb your throat or they go down your nose. But in order to sing, they went down my nose. And I'm sitting there and I'm thinking, well, what if I sang Dream On? Now, his clinic just happens to have a piano at the end of the hallway.
Right.
Ran down, hit an F minor, and I hit the Dream On, Dream On! And then I went to National Geographic and I said, would you guys mind doing, and one thing led to another, you know, we're doing a human body thing. And so while I was in the chair and he was scoping me, I sang that note and they fused it together.
And what were you surprised at, Doctor, in terms of the wear and tear that his vocal cords take in the average performance?
Sure. I mean, you get two different perspectives as a surgeon. One is in the office, and what'll show in the National Geographic special is what his bleeding looked like because we digitally record everything.
Right.
And then you get the perspective of a surgical microscope, so you get to see decades of high-performance singing and the effect on these soft tissues.
That's bizarre. What exactly are we looking at right
You
there?
are looking at Stephen creating sound at unusual frequencies for these. His vocal fold tissues that are vibrating at that point are probably the size of an infant, but he's driving it with unbelievable lung pressure.
And what we should say is we're taking one aspect of this incredible human machine special, your vocal cords, but similar technology is used to look at the eyes, the heart, the lungs, the digestive system. So this is really a full body treatment here, and not that yours aren't the most important, but it certainly I'm sure it's interesting for you to look at the whole picture.
Well, they put me in a vest that took my...
Yeah, we took pulse respirations, and we actually, our scientists at the Mass General designed a device that we could monitor the voice without recording it. So what we had calculated is that his vocal cords in that one show collided actually 780,000 times,
Oh my gosh.
which was the equivalent of traveling 6 miles.
And real quickly, your voice okay now? I mean, you're completely healed?
It's beautiful.
Which is great, because we want to invite you and the guys to come for an outdoor concert next year.
I'll be right over.
Good. Booked. All right. Doctor, thanks so much.
Thank you
Stephen,
very
good to
much.
see you again.
Thanks a lot.
And again, the incredible human machine.
All right, so that's kind of cool to see the vocal cords in action and talking about how many times his vocal cords smacked together in one concert. I think he said 780,000 times. That's just amazing. So anyway, I thought that was kind of cool to take a look and see that. So anyway, on to the next one. The glottis. It's a triangular slit that opens during breathing and talking and closes during swallowing. Because obviously we don't want to get any food or drink down into the trachea. And then the epiglottis covers it up to give us even greater protection to keep food and drink from entering the airway. So if that's the glottis right there, right? So the epiglottis, this guy right here, is going to come down and he's going to fold down and cover up this whole area. Epi means above, or right next to, right above. So that's why it's the name epiglottis. It comes down right on top of the glottis. Laryngitis is inflammation of the larynx that makes the voice hoarse, or you might lose your ability to speak altogether for a while. It can be caused by illnesses, allergies, smoking, some medications. So if you have that chronically, you might want to see an otolaryngologist, something like that. Try that again. Otolaryngologist. I think that's how you say it. That's kind of a tough one to say. So below that we have the trachea, what most people call the windpipe. It's a flexible cylinder with the cartilage rings, hyaline cartilage rings that give it the stiffness it needs to keep it from collapsing. And then from the trachea, that leads down into the bronchial tree. And here that is. So we go from the trachea to the primary bronchi, to the secondary bronchi, to the tertiary bronchi, to the bronchioles. So that's the order: trachea, primary bronchi, secondary, tertiary bronchi, and then bronchioles. The ends of the bronchioles are attached to air sacs, excuse me, called alveoli, which are connected to the circulatory system via capillaries. So this is where our gas exchange is going to occur. In the sorry about that. In the alveoli, which are going to lead to the capillaries, which allow which mine don't seem to be working very well right now, which are going to lead to the capillaries, which is going to get that oxygen into our bloodstream. The lungs are the spongy tissue housed within the pleural cavity. The visceral pleura is the membrane that covers the surface of the lungs. The parietal pleural is the membrane that lines the thoracic cavity. And in between there, you have the pleural cavity itself. All right? Sorry, guys. Our right and left lungs are not the same. Our right lung has 3 lobes. Our left lung has only 2 lobes. But the left lung has the cardiac notch. So there's a space where the heart fits in that area there, which is why we have less space on the left side and only 2 lobes. Serous fluid is what lubricates our lungs during breathing. So here's a description of the breathing mechanism. And here are the steps. First, the diaphragm will contract. So here's our diaphragm right there. When it contracts, it goes down, right? Giving more room for air to fill the lungs. So the diaphragm contracts, moves down, and air gets forced into the airways. The intercostals, those muscles between our ribs, they contract and enlarge our chest cavity even more. Surface tension in the alveoli is reduced by surfactant. This is a molecule that allows easier passage from air to liquid in the lungs. But there's enough tension still that keeps them from collapsing. Then if we want to, we can actually use other muscles in our rib cage to force ourselves to take an even deeper breath. And then after all that, the diaphragm will relax, causing elastic recoil, which is what we call when we exhale. The first breath of a newborn is the hardest due to the fact that their lungs haven't been coated with that surfactant yet. So the surfactant is a molecule that has a lipid and a protein end. So it has one end that will be hydrophilic, and then another end which will be hydrophobic. Yeah, I did say that right the first time. Anyway, one that will dissolve easier in water, and then one that will dissolve easier in oil. So it bridges the gap between the two. It makes it easier for something to pass from air into the fluid. It's produced by alveolar type 2 cells in the lungs. So when babies are born, sometimes I guess the classic thing is the doctor will give them a little smack on the rump, right, to initiate them to to gasp and take a breath. That's due to the fact that they, excuse me, man, I got all kinds of noise going today. Sorry, guys. Due to the fact that they're struggling to get that first breath. So the exhalation again, elastic recoil as the diaphragm relaxes and moves back up and then pushes the air out of our lungs. Atmospheric pressure is 760 millimeters of mercury. This pressure is necessary for breathing, which is why it's difficult to breathe in high altitudes where this pressure is so much lower, and why a punctured lung can be so dangerous because that pressure is not maintained. A pneumothorax is a collapsed lung. A hole in the pleural cavity can cause this, can cause the lung to collapse or be deflated. It's sometimes called a punctured lung, and that can indeed happen, but sometimes it's just the pleural cavity that gets punctured and not the lung. A collapsed lung or a punctured pleural cavity can be caused by an injury, a knife wound or a gunshot, something serious like that. It can also occur due to changes in the atmosphere, scuba diving, where we're going to greater pressure, or mountain climbing, where we're going to less pressure. Lung diseases can also increase the chance of this. Things like asthma, COPD, cystic fibrosis, etc. They can also cause these kinds of problems. An effusion is an accumulation of fluid in an anatomical space. So a pleural effusion would be accumulation of fluid in the lung or the pleural cavity. Thoracentesis is how you would remove that fluid. You insert a suction tube in that area to remove the fluid. And I have been told that it's quite painful. So I hope none of you ever have to experience anything like that, because I've heard that more than once, that is quite painful. Then we have some non-respiratory movements that the respiratory system is involved in, like coughing, sneezing, all that stuff you hear me do while I'm trying to talk, right? Laughing and crying. Hiccups, which is a spasm of the diaphragm. Yawns. All of these things are part of the respiratory system, possibly caused by low oxygen levels. It's funny, they still don't 100% know for sure what causes a yawn. But they're contagious. I wish I was there to see how many of you yawn just from looking at this picture. They say the logic behind that is, if it truly is that there's low oxygen levels causing yawns, you see somebody else yawn, and your brain thinks they're sucking up all the excess oxygen, so I better too. And so then you yawn. That's the way I've heard it described. I don't know if it's true or not, but it kind of makes sense as to why yawning ends up being so contagious. The volume you move in and out of your lungs can be measured with a spirometer. So spirometry measures the amount of air moving in and out of the lungs. And the respiratory cycle is one inhalation and one expiration. So in one cycle, you can measure the volume of air that you move through your lungs. I have one of those right now, a little bitty plastic portable one, and I use it several times a day. It's supposed to be exercising my lungs to improve my lung volume with everything I got going on right now. So there's two terms that associate with this. The resting tidal volume is the amount of air that enters the lungs during one cycle. So this is for a normal breath. But then we can do a vital capacity when we take a deep breath. So that becomes the amount of air that can be forced in or out when we take a deep breath. So resting tidal volume would be with just a normal breath. Vital capacity would be with a deep breath. And up on top, you're looking at spirometry the fancy way. You see, he's hooked up to a computer and he's going to have software measuring his volumes. Down below, you can also measure it just doing it into a balloon. And you measure the size of the balloon after you've filled it up. So there are simple ways to do it too. Obviously, the one at the top would be more precise. Control of breathing. So breathing itself is involuntary, but the muscles are under voluntary control. If you remember from the nervous system, the respiratory center is in the medulla and the pons in the brainstem. In that region, those neurons control inhalation and expiration. And then there's the medulla rhythmicity area. There you go. There is the dorsal group and the ventral group. The dorsal one controls the rhythm. Having trouble saying that word. And the ventral group controls how much is forced. And then there's the pneumotaxic area in the pons, which would inhibit respiration. Factors that can affect breathing. There are chemosensitive areas in the medulla. They will detect concentration of chemicals like carbon dioxide and hydrogen. So they would detect things like a rise in CO2, low blood oxygen, or if we're emotionally upset, fearful, in pain, all those kinds of things would then affect our breathing. I look at this picture and I think of, I think it was the first Toy Story where he says, "That ain't no happy child." Hyperventilation, where we have increased breathing. It's faster and shorter. That's going to lower CO2 concentrations in our blood. So the blood pH will rise. You call that alkalosis. And we will get symptoms like getting dizzy, having headaches, fainting, weakness, tingling in the lips, hands and feet, etc. And a quick and simple way to restore this is to breathe into a bag. So we are forcing CO2. We breathe it out, but then we're breathing a lot of it right back in again. So that way we are forcing our CO2 levels to increase. The respiratory membrane in the lungs, where the gas exchange occurs, is a layer of simple squamous cells. Maybe you remember that from the tissue section. And the oxygen will diffuse into the bloodstream. But we have other things that can do that too, like alcohol. And the poor guy in here looks like he's had a little too much of that. Hypoxia is a disease where there's an overall lack of oxygen content within the body's tissue and organs, specifically the brain. So hypoxia can have several causes: cardiac arrest, head trauma, carbon monoxide poisoning, suffocation, strangulation, as well as any other instance where the oxygen is deprived from the body. So then we have asphyxia, where you have severely deficient supply of oxygen that comes from being unable to breathe normally. So one of the main examples of this would be choking. So asphyxia would cause a generalized hypoxia, which would primarily affect the tissues and organs. We have some illnesses related to the respiratory system. First one is cystic fibrosis. This is a hereditary disease where you get too much mucus clogging the lungs. And it makes it difficult to breathe and causes a lot of infections. It is a recessive condition. So they're showing here, what if you have parents who are both carriers? What's the chance they'll have a child with the disease? So you need two small f's, right, to get that? So the chance of them having a child with the disease would be 1 in 4, right? If you do your Punnett square, we'd end up with that being 1 in 4. Then there's COP, chronic obstructive pulmonary disease. An obstruction of the airway that occurs with chronic bronchitis and/or emphysema. You can see from these cross sections, all that inflammation in there and excess mucus greatly narrows the passageway for the air to get through. Or you can have breakdown of the alveolar membranes. So they're not working properly anymore. And the most common cause of these? Smoking. So your life lesson for today. Stay away from that. Stay away from smoking. There's bronchitis. Again, we have inflammation of the main air passages to the lungs and a lot of excess mucus. It can be short-lived. Sorry, guys. A lot of times you can get bronchitis from some infection, right? But it'll clear up once the infection clears up. Or it can be chronic, meaning that it sticks around and keeps coming back. Emphysema. I am so sorry. But basically, you get a lot of harmful particles, there we go, from things like smoking that get trapped in the alveoli, triggers an inflammatory response, and those chemicals will dissolve the membranes in the alveoli to the point where they can no longer function, which is really a bad thing. There's also sleep apnea, where we have a pause or slowing of breathing during our sleep. You see they're trying to show you here the soft palate, the tongue can relax and fall down back on the back of the pharynx there and block the airways. So people with this use a CPAP machine, continuous positive airway pressure. So it keeps pressure inside of those areas and prevents that from happening. These are, I guess, some of the older images of those. I'm told that nowadays they make ones that are much less difficult to wear. People that have these, that's one of the complaints that I've heard about them, is that they're just not very comfortable. But I believe they have made some significant advancements in the design of these machines. There are pulmonary embolisms. An embolism is a blood clot that's, if it's a pulmonary, there's one that has moved to the lungs. As you can imagine, that would be highly problematic. Blood clots anywhere can be highly problematic, and the lungs are no exception. There's also lung cancer. One of the problems with lung cancers is that there's often no early signs or early symptoms until they have grown large enough that they start affecting your breathing, your coughing. So you'll be coughing, wheezing, shortness of breath, you'll have bloody mucus. So unfortunately, a lot of times they're not detected until they're well established. There's altitude sickness. Something mountain climbers have to pay a lot of attention to, because you get up into some of these really high altitudes, the air pressure decreases and the oxygen levels decrease, both of which are really bad for your breathing. The symptoms can range from mild to life-threatening. It can affect the nervous system, the lungs, the muscles, and the heart. A pulmonary edema is an abnormal buildup of fluid in the air sacs of the lungs, which leads to shortness of breath. And that's one of the things that can happen with altitude sickness. If you look at the URL here for this image, Mount Everest, one that I guess all the extreme mountain climbers love to try to ascend. But unfortunately, there's a lot of people that don't make it, and those that don't are just left there because it's too much work to try to bring them down. So I guess at the time, see, that's 2011. At that time, they estimated there were over 200 dead bodies up on Mount Everest. I gotta believe there's even more now. So unfortunately, the altitude sickness gets to a lot of people who try to climb these high mountains. Asthma. Rapid inflammation of the bronchial tubes with increased production of sticky secretions inside the tubes. People with asthma experience symptoms when the airways tighten or fill with mucus. Again, it's that same concept of inflammation and excess mucus inside the bronchial tubes, greatly reducing the passageway for the air. So you get coughing, wheezing, shortness of breath, chest pain and tightness. So bronchial dilators are used to open those airways. The main one used is called albuterol, which is in most inhalers. I'm using an awful lot of that right now, actually. We can also have numerous bacterial or viral infections that can impact our breathing. Pneumonia, tuberculosis, influenza, the rhinovirus, of course, coronavirus, all of these guys, and many more. And then there's one called whooping cough, Bordetella pertussis, a bacterial infection. Causes serious coughing and gasping for breath, which is very dangerous for infants. If you look at this chart over here, the cases prior to the 1960s were there were significant numbers until the vaccine came along. And you notice how the vaccine all but reduced that down to zero. But you notice that last data is in 2013. The numbers have started to come back. And they would primarily attribute that to people who were the last, 5-10 years or so, 12 years, have chosen not to get the traditional childhood vaccines for their kids. And so numbers of things like whooping cough are coming back. And I guess this gets into a whole nother area. Since I'm not there, we wouldn't be able to have a discussion about it unless you want to, of whether or not you think vaccines should be required for all children. And that gets into the whole thing of what's been going on with the COVID vaccine, right? Is whether or not everybody should be required to have your COVID vaccines. So if you guys want to spend a little time discussing that, that's perfectly fine. And, one of the areas of employment here is a respiratory therapist. I know those salaries you see are old, but they make decent salaries. And I have seen a number of respiratory therapists over the past few weeks with everything that I got going on. And this is the handout that you'll be given now, which will become your homework, which will be due 1 week from today. And I'm pretty sure your handout's got the, oh goodness sakes, the word bank attached to it as well. So that's the end of this. Again, I apologize for all the coughs. I'm doing the best I can. And we will end it there. And I'll see you guys real soon when I come back.